In this on-demand video, we will be reviewing commonly underscored CANS items. This is part 1. We will begin with reviewing 6 commonly underscored CANS items. We will then test your skills on scoring those 6 CANS items. Commonly underscored CANS items. We will be looking at number 3, emotional abuse, which is in the trauma domain. Number 12, witness or victim to criminal activity, which is also in the trauma domain. Number 19, dissociation, which can be found in the traumatic stress symptoms domain. 47, cultural stress in the acculturation domain. 55, attachment difficulties in the child behavioral emotional needs domain. And 57, affect dysregulation, also in the child behavioral emotional needs domain. Number 3, emotional abuse. This rating describes the degree of severity of emotional abuse, including verbal and nonverbal forms. Note, this is a historical and cumulative trauma item. When looking at the rating system for emotional abuse, we see that 0, there is no evidence that the child has experienced emotional abuse. A 1, the child has experienced mild emotional abuse. For instance, child may experience some insults or is occasionally referred to in a derogatory manner by caregivers. A 2, the child has experienced moderate degree of emotional abuse. For instance, child may be consistently denied emotional attention by caregivers, insulted or humiliated on an ongoing basis, or intentionally isolated from others. And a 3, the child has experienced significant emotional abuse over an extended period of time, at least 1 year. For instance, the child is completely ignored by caregivers or threatened and terrorized by others. Number 12, witness or victim to criminal activity. This rating describes the severity of exposure to criminal activity. Criminal behavior includes any behavior for which an adult could go to prison, including drug dealing, prostitution, assault, or battery. Note, this item is in the trauma domain and is historical and cumulative. We see that for number 12, a 0, there is no evidence that child has been victimized or witnessed significant criminal activity. A 1, the child is a witness of significant criminal activity. A 2, the child is a direct victim of criminal activity or witnessed the victimization of a friend or family. And 3, the child is a victim of criminal activity that was life-threatening or caused significant physical harm, or the child witnessed the death of a loved one. This item correlates to several other CANS items, including sexual or physical abuse, as well as domestic violence. We believe this item is underscored because we often see these items scored, but the number 12 is not scored. Number 19, dissociation. Symptoms included in this dimension are daydreaming, spacing or blanking out, forgetfulness, fragmentation, detachment, and rapid changes in personality, often associated with traumatic experiences. This dimension may be used to rate dissociative disorders, such as dissociative disorder not otherwise specified, dissociative identity disorder, but can also exist when other diagnoses are primary, for example, PTSD or depression. Note, this is a traumatic stress symptom domain item and is rating how the youth is coping with trauma. When looking at the rating levels for dissociation, we see that a 0 is given to a child with no evidence of dissociation. A 1 is a rating given to a child with minor dissociative problems. These can include some emotional numbing or avoidance of detachment, and some difficulties with forgetfulness, daydreaming, spacing, or blanking out. A 2 is a rating given to a child with a moderate level of dissociation. This can include amnesia for traumatic experiences or inconsistent memory for trauma. Examples may include losing things easily, forgetting basic information, frequent daydreaming or trance-like behavior, depersonalization and/or derealization. This rating would be used for someone who meets criteria for dissociative disorder not otherwise specified, or other diagnosis that is specified with dissociative features. And a 3 is a rating given to a child with severe dissociative disturbances. This can include significant memory difficulties associated with trauma that include impeding day-to-day functions. Child is frequently forgetful or confused about things that they should know. For example, they may have no memory for activities or whereabouts of the previous day or hours. The child shows rapid changes in personality or evidence of distinctive personalities. And a child who meets criteria for distinctive identity disorder or a more severe level of distinctive disorder not otherwise specified would be rated here. Number 47, cultural stress. Cultural stress refers to experiences and feelings of discomfort and/or distress arising from friction, real or perceived, between an individual's own cultural identity and the predominant culture in which they live. Cultural stress rating levels. 0, no evidence of stress between the child's cultural identity and current living situation. A 1, some evidence of mild or occasional stress resulting from friction between the child's cultural identity and their current living situation. A 2, child is experiencing cultural stress from friction between the child's cultural identity and current living situation, and that is causing some problems with functioning. And a 3, the child is experiencing high level of cultural stress between their cultural identity and current living situations that is making functioning very difficult under the present circumstances. We believe that this item is underrated because when we look at the acculturation domain, we see that this is actually only scored about 1% of the time. Number 55, attachment difficulties. This item should be rated within the context of the child's significant parental or caregiver relationship. Within attachment difficulties, we will see that a 0 shows no evidence of attachment problems. Caregiver-child relationship is characterized by mutual satisfaction of needs and child's development of a sense of security and trust. Caregiver appears to respond to child's cues in a consistent, appropriate manner, and child seeks age-appropriate contact with caregivers for both nurturing and safety needs. A 1, mild problems with attachment. There is some evidence of insecurity in the child-caregiver relationship. Caregivers may at times have difficulties accurately reading child's bids for attention and nurturance, may be inconsistent in response, or may be occasionally intrusive. Child may have some mild problems with separation, for example, anxious, clingy behavior in the absence of obvious cues of danger, or may avoid contact with caregivers in age-appropriate ways. Child may have minor difficulties with appropriate physical, emotional boundaries with others. A 2 would rate moderate problems with attachment. Attachment relationship is marked by significant difficulties as to require intervention. Caregiver may consistently misinterpret child's cues, act in an overly intrusive way, or ignore or avoid child's bids for attention or nurturance. Child may have ongoing difficulties with separation, may consistently avoid contact with caregivers, and may have ongoing difficulties with physical or emotional boundaries with others. A 3 is a rating for severe problems with attachment. Child is unable to form attachment relationships with others. For instance, they may have chronic dismissal, avoidance, detached behavior in caregiving relationships. Or the child presents with diffused emotional, physical boundaries leading to indiscriminate attachment with others. Child is considered at ongoing risk due to nature of their attachment behaviors. A child who meets the criteria for an attachment disorder in the DSM would be rated here. Child may have experienced significant early separation from or loss of caregiver, or have experienced chronic inadequate care from early caregivers, or the child may have individual vulnerabilities such as mental health or developmental delays that interfere with the formation of positive attachment relationships. Please note that when we look at the ratings of attachment difficulties, we see that there's an element not just to how the child is responding or attaching to the caregiver, but also how the caregiver is responding or attaching to that child. 57. Affect dysregulation. These symptoms include difficulties modulating or expressing emotions, intense fear, helplessness, difficulties regulating sleep-wake cycles, and inability to fully engage in activities. A 0 for affect dysregulation is a rating given to a child with no difficulties regulating emotional responses. Emotional responses are appropriate to the situation. A 1 is a rating given to a child with some minor difficulties with affect regulation. This child could have some difficulties tolerating intense emotions and becoming somewhat jumpy or irritable in response to emotionally charged stimuli, or more watchful or hypervigilant in general. This child may have some difficulties sustaining involvement in activities for any length of time. A 2 is a rating given to the child with moderate problems with affect regulation. This child may be unable to modulate emotional responses. This child may exhibit marked shifts in emotional responses. For instance, sadness to irritability to anxiety, or have contained emotions with a tendency to lose control of emotions at various points. Examples include normally restricted affect punctuated by outbursts of anger or sadness. This child may also exhibit persistent anxiety, intense fear or helplessness, or lethargy, loss of motivation. A 3 is a rating given to a child with severe problems with highly dysregulated affect. This child may have more rapid shifts in mood and an inability to modulate emotional responses, feeling out of control of their emotions. This child may also be characterized by extreme lethargy, loss of motivation or drive, and no ability to concentrate or sustain engagement in activities. They may be emotionally shut down. We also see that there's an NA option on this item. This will only apply to children who are under the age of 5. In the next slides, we will practice what we learned. How would you rate number 3, emotional abuse, for the following scenario? A 10-year-old's father will sometimes call him stupid when he makes a mistake. The preferred score for this scenario would be a 1. Child has experienced mild emotional abuse. For instance, child may experience some insults or is occasionally referred to in a derogatory manner by caregivers. True or false? Number 12, witness victim to criminal activity is scored when a child has experienced physical or sexual abuse, even if the perpetrator is unknown or not convicted. This is true. This rating describes the severity of exposure to criminal activity. Criminal activity includes any behavior for which an adult could go to prison, including drug dealing, prostitution, assault, or battery. In this case, we would score 2 because the child was a direct victim of that crime. When considering number 19, dissociation, true or false? If a child has any identified significant historical trauma experiences, CANS items 1 through 13, it is important to consider the impact of the child's ability to stay focused, present in the moment, and ability to follow through on tasks. True. Dissociation behaviors can often look like attention deficit disorder behaviors. It is important to understand a child's history when scoring this item. How would you score 47 cultural stress? David recently was placed in a group home in a new neighborhood. He is 15, black, and had lived in a predominantly black area of Chicago for most of his life. The neighborhood he has been placed in is predominantly white, as are many of the staff at the group home. Neighbors have called the police when seeing him walk around the block, and on a few occasions he has felt harassed by the police. He ultimately was released to staff, but no longer feels safe leaving the placement. He says these walks help him to clear his head, and as a result has been losing his temper more often. Police have also been called to the placement by staff stating that they feel threatened by David. David states that he sometimes loses his temper, but that he is not aggressive and has not threatened staff or other youth in the home. He no longer leaves his room and has become completely withdrawn or angry with staff and his peers. Based on this scenario, a worker might score this item a 3. Child is experiencing a high level of cultural stress between their cultural identity and a current situation that is making functioning very difficult under the present circumstances. How would you score 55 attachment? A youth with a history of neglect with his biological mother and an absent father isolates and is largely unresponsive to his family when they attempt to engage him. He strives to be alone and does not attempt to make friends or join age-appropriate activities. The youth seems very uncomfortable when speaking to others and prefers to interact with the world through his phone. The behaviors this youth exhibits presents a significant risk to his healthy development. The preferred score for this scenario is a 3. This youth is demonstrating avoidance and detached behavior within significant relationships, and this extends to other typical forms of belongingness. The youth's inability and lack of motivation to connect with others is a significant concern. How would you score 57 affect dysregulation? A 7-year-old struggles to control their feelings of frustration in some social situations. What would be experienced as minor frustrations by most are felt more intensely by this youth. The youth will occasionally snap at other children and act out. The behaviors can be managed, and typically the child re-engages in the social setting after being redirected. The preferred score for this situation would be a 1. The child is currently able to recover quickly when the emotions overtake them and drive their behaviors. However, this should be monitored, and if worsened, an intervention or service may be needed to be put in place.